Sunstroke. Heat stroke is a condition caused by your body overheating, usually as a result of prolonged exposure to or physical exertion in high temperatures. Heat exhaustion is not usually serious if you can cool down within 30 minutes. If it turns into heat stroke, it needs to be treated as an emergency. Heat stroke is the most serious heat-related illness. Heat stroke is a form of hyperthermia in which the body temperature is elevated dramatically. It occurs when the body can no longer control its temperature. The body's temperature rises rapidly, the sweating mechanism fails, and the body is unable to cool down. When heat stroke occurs, the body temperature can rise to 106 degrees Fahrenheit or higher within 10 to 15 minutes. The body normally generates heat as a result of metabolism. Body is usually able to dissipate the heat by radiation of heat through the skin or by evaporation of sweat. However, in extreme heat, high humidity, or vigorous physical exertion under the sun, the body may not be able to sufficiently dissipate the heat. The body temperature rises, sometimes up to 106 Fahrenheit, 41.1 Celsius, or higher. Another cause of heat stroke is dehydration. A dehydrated person may not be able to sweat fast enough to dissipate heat, which causes the body temperature to rise. Heat stroke is not the same as a stroke. Stroke is the general term used to describe decreased oxygen flow to an area of the brain. Heat stroke can cause permanent disability or death if the person does not receive emergency treatment. Heat stroke is defined as a core body temperature elevated above 104 degrees Fahrenheit associated with central nervous system dysfunction and end organ damage. The CNS dysfunction can be observed in several ways, including confusion, delirium, aggression or irritability, seizures, altered consciousness, and coma. Heat stroke can occur as classic heat stroke, non-exertional, or exertional heat stroke. Classic heat stroke usually afflicts the elderly population in the summer season and can be related to a lack of access to adequate air conditioning. Heat is continually absorbed from the environment and may be poorly dissipated secondary to other medical conditions and medications that preclude cooling. Exertional heat stroke is seen in a younger and more athletic population and does not necessarily occur in hot and humid environments. Other signs and symptoms are similar to those seen in heat exhaustion, but vital sign abnormalities are more likely to be present. The presence or absence of sweating does not make a diagnosis of heat stroke. Examining a collapsed individual can be difficult. The differential diagnosis can extend beyond heat exhaustion and heat stroke to include cardiac arrhythmia and exercise-associated hyponatremia. It is important to maintain a degree of suspicion for those athletes who present with collapse but do not have an elevated core temperature. The term heat injury is not currently recognized by the World Health Organization as a diagnosis. It was created by the U.S. military physicians to further categorize patients suffering from heat illness. Heat injury. Heat injury is diagnosed as an elevation in core temperature above 104 degrees Fahrenheit with associated end organ damage but lacks the CNS dysfunction seen in heat stroke. Organs most commonly affected with heat stroke or injury include the liver, kidneys, and skeletal muscle, rhabdomyolysis. Individuals who present with heat stroke should be assessed beginning with basic life support measures. Secure the airway and make sure adequate circulation and breathing are maintained. An initial set of vital signs including a rectal temperature should be performed and repeated throughout the course of treatment. If the rectal thermometer is not available, do not use other methods to determine temperature. If available, rapid assessment of serum electrolytes including sodium and glucose should be done, especially with longer endurance events such as marathons. Rapid cooling should commence as soon as possible after the diagnosis is made, as the prognosis worsens the longer the core temperature is elevated. The most effective cooling measure is ice water immersion and expected cooling rates are about 1 degree Fahrenheit per 3 minutes or 1 degree Celsius per 5 minutes of immersion. Measurement with a rectal thermistor allows for continuous monitoring. If this is not available, measurement by a rectal thermometer should be done approximately once every 10 minutes. Cooling should continue until the core temperature reaches 101 degrees Fahrenheit. If no rectal thermometer is available, cool until the athlete begins to shiver about 15 to 20 minutes. Other interventions need to be performed are intubation, administration of 4 medications or fluid and ice water immersion. If it is not practical, other cooling tactics such as ice bags to the groin, axilla, and neck, and placement of ice or water-soaked towels to the rest of the body should be performed. Fluid resuscitation should be performed, but careful attention should be paid to fluid overload, as pulmonary edema can develop with rapid administration of fluids. Despite rapid reduction in core temperature, these individuals are still at risk for organ damage. Therefore, transport to the hospital is usually necessary, where appropriate monitoring and lab evaluation can be performed. Transport to the hospital is always required in patients who do not regain consciousness within 30 minutes. That is after appropriate cooling and medical intervention, or if appropriate response to cooling is not achieved. Rhabdomyolysis, rhabdo, is a medical condition associated with heat stress and prolonged physical exertion. Rhabdo causes the rapid breakdown, rupture, and death of muscle. When muscle tissue dies, electrolytes and large proteins are released into the bloodstream. This can cause irregular heart rhythms, seizures, and damage to the kidneys. Heat stroke can kill or cause damage to the brain and other internal organs. Although heat stroke mainly affects people over age 50, it also takes a toll on healthy young athletes. Heat stroke often happens as a progression from milder heat-related illnesses such as heat cramps, heat syncope, fainting, and heat exhaustion. But it can strike even if you have no previous signs of heat injury. Heat stroke results from prolonged exposure to high temperatures. It is usually in combination with dehydration, which leads to failure of the body's temperature control system. Medical definition. The medical definition of heat stroke is a core body temperature greater than 104 F. It has complications involving the central nervous system that occur after exposure to high temperatures. Other common symptoms include nausea, seizures, confusion, disorientation, and sometimes loss of consciousness or coma. What are the symptoms of heat stroke? Heat stroke signs and symptoms include 1. High body temperature. A core body temperature of 104 Fahrenheit, 40 Celsius, or higher, obtained with a rectal thermometer, is the main sign of heat stroke. 2. Altered mental state or behavior. Confusion, agitation, slurred speech, irritability, delirium, seizures and coma can all result from heat stroke. 3. Alteration in sweating. In heat stroke brought on by hot weather, your skin will feel hot and dry to the touch. However, in heat stroke brought on by strenuous exercise, your skin may feel dry or slightly moist. 4. Nausea and vomiting. You may feel sick to your stomach or vomit. 5. Flushed skin. Your skin may turn red as your body temperature increases. 6. Rapid breathing. Your breathing may become rapid and shallow. 7. Racing heart rate. Your pulse may significantly increase because heat stress places a tremendous burden on your heart to help cool your body. 8. Headache. Your head may throb. 9. Oliguria, low urine output. 10. Lung crackles, bubbling or gurgling sound in the lungs. 11. Syncope, fainting, or loss of consciousness. Causes: heat stroke can occur as a result of exposure to a hot environment, in a type of heat stroke, called non-exertional, classic, heat stroke. Being in a hot environment leads to a rise in core body temperature. This type of heat stroke typically occurs after exposure to hot, humid weather, especially for prolonged periods. It occurs most often in older adults and in people with chronic illness. Strenuous activity. Exertional heat stroke is caused by an increase in core body temperature brought on by intense physical activity in hot weather. Anyone exercising or working in hot weather can get exertional heat stroke, but it's most likely to occur if you're not used to high temperatures. In either type of heat stroke, your condition can be brought on by wearing excess clothing that prevents sweat from evaporating easily and cooling your body, drinking alcohol, which can affect your body's ability to regulate your temperature, becoming dehydrated by not drinking enough water to replenish fluids lost through sweating. What are the potential complications of heat stroke? People with heat stroke can develop shock or slip into a coma. High body temperature can lead to acute respiratory distress syndrome, ARDS, brain swelling, kidney failure, liver failure, metabolic dysfunction. nerve damage, reduced blood flow to the heart and other circulatory problems. Risk factors for heat stroke. Anyone can develop heat stroke, but several factors increase your risk. Age. Your ability to cope with extreme heat depends on the strength of your central nervous system. In the very young, the central nervous system is not fully developed, and in adults over 65, the central nervous system begins to deteriorate. This makes your body less able to cope with changes in body temperature. Both age groups usually have difficulty remaining hydrated, which also increases risk. Exertion in hot weather. Military training and participating in sports, such as football or long-distance running events, in hot weather are among the situations that can lead to heat stroke. Sudden exposure to hot weather. You may be more susceptible to heat-related illness if you're exposed to a sudden increase in temperature, such as during an early summer heat wave or travel to a hotter climate. Limit activity for at least several days to allow you to acclimate to the change. However, you may still have an increased risk of heat stroke until you've experienced several weeks of higher temperatures. A lack of air conditioning. Fans may make you feel better, but during sustained hot weather, air conditioning is the most effective way to cool down and lower humidity. Certain medications. Some medications affect your body's ability to stay hydrated and respond to heat. Be especially careful in hot weather if you take medications that narrow your blood vessels, vasoconstrictors. Regulate your blood pressure by blocking adrenaline, beta blockers, rid your body of sodium and water, diuretics. Or reduce psychiatric symptoms, antidepressants or antipsychotics. Stimulants for attention deficit or hyperactivity disorder, ADHD, and illegal stimulants such as amphetamines and cocaine also make you more vulnerable to heat stroke. Certain health conditions, certain chronic illnesses, such as heart or lung disease, might increase your risk of heat stroke. So can being obese, being sedentary and having a history of previous heat stroke. How is heat stroke diagnosed? Healthcare providers typically diagnose heat stroke in the emergency department. They review your symptoms, perform a physical exam and take your temperature. They may also order blood tests or urinalysis. Additional tests might include a chest X-ray or electrocardiogram, EKG, to monitor the electrical activity in your heart. How is heat stroke treated? Heat stroke requires immediate medical treatment. If you're waiting for an ambulance to arrive, try to cool the person as much as possible by ice packs. Applying ice packs to the neck, groin and armpits. Encouraging them to drink slightly salted fluids, such as sports drinks or salted water. Having them lay down in a cool, shady, well-ventilated environment. Immersing them in cool water, if possible. Misting them with water and blowing air across their bodies, evaporative cooling. Monitoring their breathing carefully and removing any airway blockages. Not giving any medications, including aspirin and acetaminophen. Removing any clothing that is tight or heavy. At the hospital, the person with heat stroke may receive cooled intravenous fluids through a vein in their arm. Cooling blanket, ice bath. Medication to prevent seizures. Supplemental oxygen. Sometimes cold water lavage is necessary. This treatment uses catheters, thin, flexible tubes, to fill body cavities with cold water. This helps lower the body temperature overall. The catheter may go into the rectum or down the throat. Healthcare providers stop cooling treatments once the body reaches about 102 degrees Fahrenheit, 38.9 degrees Celsius. The length of time you stay in the hospital depends on the severity of your heat stroke and how well your organs are functioning. Prevention of heat stroke. Heat stroke is predictable and preventable. Take these steps to prevent heat stroke during hot weather. Wear loose-fitting, lightweight clothing. Wearing excess clothing or clothing that fits tightly won't allow your body to cool properly. Sunburn affects your body's ability to cool itself, so protect yourself outdoors with a wide-brimmed hat and sunglasses and use a broad-spectrum sunscreen with an SPF of at least 15. Apply sunscreen generously, and reapply every 2 hours, or more often if you're swimming or sweating. Drink plenty of fluids. Staying hydrated will help your body sweat and maintain a normal body temperature. Be on the lookout for heat-related problems if you take medications that can affect your body's ability to stay hydrated and dissipate heat. Never leave anyone in a parked car. This is a common cause of heat-related deaths in children. When parked in the sun, the temperature in your car can rise 20 degrees Fahrenheit, more than 11 Celsius, in 10 minutes. It's not safe to leave a person in a parked car in warm or hot weather, even if the windows are cracked or the car is in shade. When your car is parked, keep it locked to prevent a child from getting inside. Take it easy during the hottest parts of the day. If you can't avoid strenuous activity in hot weather, drink fluids and rest frequently in a cool spot. Try to schedule exercise or physical labor for cooler parts of the day, such as early morning or evening. Get acclimated. Limit time spent working or exercising in heat until you're conditioned to it. People who are not used to hot weather are especially susceptible to heat-related illness. It can take several weeks for your body to adjust to hot weather. Be cautious if you're at increased risk. If you participate in a strenuous sporting event or activity in hot weather, make sure there are medical services available in case of a heat emergency.